Hi, it's Jenny B, NSWOC, and we're back with our Pain in the Butt series. We've gone past the perianal abscesses into what can happen when it becomes something that's chronic, or we've had an abscess occur 2 or 3 times. So I'm going to start with what a fistula is. So a fistula is an abnormal communication between two organs. And in this case, it's usually between the skin and the rectum, or the bowel, the lower bowel. So, and this is usually happens when we've had a perianal abscess. It's reoccurred multiple times, 2 or 3 times. Usually by the third time, we're getting a little concerned that there might be something else going on. So one of the ways to actually help determine this is that we're going to actually end up having to do a rectal exam. So that's where our finger's going to go into the bottom, and then we're going to use our lovely probe and groove, and we're going to insert this into where the abscess or the wound is that we're seeing. And then what the surgeon can tell is that if this little metal tip is then touching his fingers when he's inserted it, we know that there's actually this abnormal communication. So some of the other things that can actually cause it are just infections in the anal glands. We don't know why this happens. Often it can be related to ingrown hairs and sebum production. But Crohn's disease is one of those diseases that it is an inflammatory bowel disease, that it does one of 3 things. It either strictures, inflames, or fistulates. And one of the things that can be actually quite common is that they end up with fistulas in the perineal or perianal area. Also, it can happen due to trauma. I actually see this quite often in people that are road bikers and they do long-term biking. So when they're sitting on a small bike seat for long periods of time, they often can develop these. So it is one thing that I do often caution and do always encourage that they end up getting gel cushions or some of those fancy pants with the gel built right into them. Another is again that they can be these abscesses that have been untreated that the patient may not even know about. There's also in the rare case that it can be a cancer, but 95% of cancers are adenocarcinoma, but in the rare case there's also squamous cell carcinomas that can occur, and then this can cause fistulation. So what can we do about it? Well, one of them is called the lift procedure. So this is where a surgeon will actually put a small little snare with a guide wire into the actual fistula, try to open the fistula up, scrape it out, and then try to close it. They can't always close it though. One of the other things that they will use is what's called a seton drain. These are small little wee round tubes that they will actually put into the fistula. So where it will be hanging, it'll go through wherever this track is. Usually it's somewhere along the outside, and then it will actually come out their bottom. And what this happens to do is, well, the goal is to actually try to pull the fistula towards the rectum so that the track no longer excretes any effluent out of the hole or the opening. Again, this is where they can get a lot of purulent fluid and this chronic abscess formation. So sometimes they will just try to clean out the tract as well and then place the seton drain in. This is another type, but we actually have these small, lovely round ones. So what you're usually seeing is a long tubular piece inside, and then they surgically tie at the ends here, quite often like this, and you're only actually seeing these 2 little loops that are sticking out. So this is the seton drain, and this again will help pull that fistula over so that it doesn't become chronic, and they will eventually, go away. Unfortunately, it often is just bad luck. It's not always something that we know or that someone's predisposed to, but again, this is one of the basic management, surgical management techniques we have. So the other big pieces are that once you do have a seton drain placed in, that we are going to be doing sitz baths of some sort. You can either do that in a bathtub, you can do that in a shower, you can use a bidet, but we do need to keep the area nice and clean, because there's always going to be a little bit of drainage coming out, either from the rectum or from the old abscess, and that usually cleans up in a couple weeks, but then we have to leave the drain in for 3 to 6 months to help actually pull that fistula over, depending on how far away it is. As I said, it can be up to 5 centimeters or so, sometimes it's more, but not often. It doesn't often go much further than that. And then for aftercare, if there is any other drainage that's coming out, often we actually suggest the use of peri pads because they are readily available. I know there are feminine hygiene products. It's not something men really want to use, but there's also lots of different sizes, and some actually come with some deodorant in them if it is if any odor is a concern to you. And also, again, just a good plain old gauze. Sometimes it's way deep in there, and the peri pads are just not going to catch it all. And sometimes from the fluid, you're able to you end up getting a rash. So sometimes the gauze is helpful in there. Also, just using some zinc oxide on the peri wound skin if there is any rashing from the fluid that's coming out. Anyways, that's my little spiel on one of the last keys in the pain in the butt series. I'll be back again with one more because, yeah, really are a pain in the butt. And don't forget, best wound is a closed one.